Hi everyone, I'm Dr. Abhin Miglani. I will be discussing a journal club presentation on the topic Anatomical Study of Pterygoid Implants, Artery and Nerve Passage through Bone Dehiscence of Greater Palatine Canal. So, it was an article published in the International Journal of Implant Dentistry in the year 2024 by Taniguchi et al. So, the pterygoid implants target the anatomical structures of the posterior maxilla, including the maxillary tuberosity, the pyramidal process of the palatine bone, and the pterygoid process of the sphenoid bone. So, coming to the processes of the palatine bone, so there are three major processes of the palatine bone: the orbital process, the sphenoidal process, the pyramidal process. Coming to the parts of the sphenoid, the body, the lesser wing of sphenoid, pterygoid process, and the greater wing of sphenoid. The pyramidal process and the pterygoid process have greater bone quality than do the maxillary alveolar process and tuberosity. Pterygoid implant placement has been associated with the risk of damaging the greater palatine canal, a thin passage through which the descending palatine artery, vein, and the greater palatine nerves run to supply or innervate the mucosa of the maxillary and the palatine bones via the greater palatine foramen. So in this skull, from the axial view in the 3D section, we can see the hard palate, maxilla, zygomatic arch, pterygomaxillary fissure, posterior nasal spine, the medial wall of the greater palatine canal. So the greater palatine canal is formed medially by the perpendicular plate of the palatine bone, anteriorly by the infratemporal surface of the maxilla, posteriorly by the pterygoid process of the sphenoid. So the greater palatine canal runs posteriorly to the maxillary sinus, with this distance from its posterior wall to the greater palatine canal being unique for every person. The nasal cavity is located just medial to the greater palatine canal. So, the aim of this study was to perform a detailed morphological analysis of the greater palatine canal, the access risk of artery, to assess the risk of artery nerve damage during the pterygoid implant placement. So the methods was that as follows: it was a cadaveric study at Tokyo Dental College. So gross anatomy dissection was done for 5 cadavers, histology for 10 cadavers, micro-CT morphometry for 29 cadavers, measurements of distances, wall thickness, presence of bone dehiscence. So the key findings in the gross anatomy was that the greater palatine canal is bordered by palatine maxilla and sphenoid. Greater palatine nerve is always medial to the descending palatine artery. Artery is more susceptible to the injury first. So in the figure A, we can see the inferior view of the greater palatine foramen and its surrounding structures in a dry skull. In the figure B, we can see a lateral view of the dry skull and the simulation of the pterygoid implant. An unnamed suture, as shown by the pink arrow, was identified between the lateral pterygoid plate and the palatine process, pyramidal process. Then, coming to the histological analysis of these structures, and all the panels are horizontal sections. So, the G figure shows the most inferior of the superior side, and D is a high magnification view of panel. The descending palatine artery is located lateral to the greater palatine nerve. Then coming to the key findings in the micro-CT, the greater palatine canal is positioned between the nasal cavity medially and the maxillary sinus laterally. Bone dehiscence in the medial wall near the inferior nasal concha is 72.4% of the cadavers. Dehiscence allows artery and nerve passage into the nasal mucosa. Distances measured are the greater palatine foramen to the posterior maxillary tuberosity is approximately 11.44 mm. The greater palatine foramen to the medial tuberosity is roughly approximately about 4.28 mm. Then coming to the gross anatomical analysis in the greater palatine canal. So the figure A shows the medial view of the nasal cavity before dissection. The figure B shows the medial view of the nasal cavity after cutting the edges of the inferior nasal concha. The figure C shows the high magnification view of B after removing a portion of the inferior nasal concha. Only the anterior greater palatine nerve was identified. The descending palatine artery was not observed. The greater palatine nerve, greater palatine the GPN refers to the greater palatine nerve. refers to the medial nasal meatus. So coming to the micro CT images, here we can see, and coming to the histological findings. So the 50% of the cases had artery and nerve pass directly into the nasal mucosa through the medial wall dehiscence. Dehiscence rarely seen in lateral wall. So coming to the histological analysis of the bone dehiscence or the medial bony wall in the greater palatine canal. So the figure A shows a schematic illustration of the cross-section locations of the panels B to J. All panels are frontal sections. So similarly, in this image, we can also see the histological sections. So coming to the discussion part, so the risk of implant penetration into the greater palatine canal can cause the bleeding into the nasal cavity, the possible spread of inflammation, damage sequence, artery first and then the nerve, need for 2 mm of safety margin from the greater palatine canal during the implant placement, and angulation of more than 60 degree should be required with a lingual tilt to increase the risk of the GPC perforation and clinical implications that the preoperative CBCT or CT scan is essential for mapping the greater palatine canal anatomy and avoid implant trajectory too lingually. Surgeons must anticipate bleeding management if artery is injured. The racial and anatomical variation is important. The greater palatine foramen varies. The computer strengths and limitations. So it was a detailed cadaveric histological and micro-CT analysis. So first study clarifying artery versus nerve susceptibility, limited sample size, Japanese cadaveric population, clinical correlation with actual implant surgeries not tested. So the conclusion was that the greater palatine canal communicates the nasal cavity in majority of cases. Descending palatine artery is at higher risk than the nerve. Implant placement near the greater palatine canal may cause difficult to control nasal bleeding. Careful planning and knowledge of anatomy are essential for safe pterygoid implant surgery. So the take-home message is that always access the greater palatine canal anatomy before pterygoid implant placement. So artery has a more vulnerability as compared to the nerve and a minimum safe distance of more than 2 mm to minimize this risk.